So I have a question for both of you. And I'm going to start with Mike actually, and that's the fact that mental health is a issue that's prevalent in the workplace. And I'm just curious. So for Mike, how is Mauer addressing this topic?
We really support mental health year round, especially during the month of May, which is Mental Health Awareness Month.
Mhm.
We do weekly emails called Fierce Friends Talk Mental Health. At Mower, we call ourselves Fierce Friends. And we talk about mental health concerns professionally and personally. We give tips on distress and resources available. We have an employee assistance program at Mower. We even offer subscriptions to meditative apps like Calm. We offer flexible schedules, hybrid work environment. We mostly work remotely at Mower. We block all of our lunch times, so no meetings. And we have early close Fridays at 3 p.m. We also offer PTO, including mental health days. So again, mental health is something in a business like ours where there's that constant strain and drain of thinking all the time, where we want to be particularly cognizant of that.
Mhm.
So we're looking to do more and more for our employees today.
And then William, I want to, as I said, I want to give you an opportunity too to talk about how AHN is addressing mental health.
First and foremost, it's about the foundation that Highmark and AHN sets across the board as a culture for their employees. Having had worked in other healthcare systems in this region, I can tell you that Allegheny Health Network is the hospital with the heart. We treat each other like human beings. We have that deeper understanding and commitment for one another as human beings and not just like a function of your employee ID number, right? We care about ourselves, each other, and our patients. And there's a variety of programs within AHN and Highmark that have been set up to continue to support folks to give them access to care that they need internally. We have an entire behavioral health institute that is available to employees. There's a new initiative called Wellness Lifts, and we've been creating very specialized, customized mindful moments for critical care nurses in areas of the hospitals that we know experience high turnover because of the trauma and the stress that they unfortunately have to live through on a daily basis. So we're taking some really targeted looks at those areas to see how we can improve their wellness, giving them time to step aside for a minute, take a break, take a pause, take a breath, go through some meditative exercises, and then come back to work in a better space.